Hello, good morning. I am Ms. Rajathurai Dalmini, BSc Nursing student, IIHS 29 batch. I would like to teach about intramuscular injection. First, we are going to see introduction. Since the 1920s, the health professionals have been aware of the intramuscular injection, which seems to be easy to be administered, may lead to preventable complications. Intramuscular injections, which was first administered by the doctors and then the nurses with the start of the use of penicillin in the 1940s in a frequently administered nursing application. This is the most common way of injecting medication directly into a patient's. For rapid absorption of the medicine, this is a very useful process because the medicine from this injection is inserted directly into the muscles. This allows the medicine to gain easy access to the bloodstream and quickly begin its healing work. Intramuscular injections are the best and safest way of injecting medicine into a patient. Next definition. An intramuscular injection is when medication is injected deep into muscles, or intramuscular injection is the injections of substance directly into muscles. Now we are going to see types of injection. Mainly 4 types of injections are there. Number 1, intradermal. Next, subcutaneous, intravenous, and intramuscular. Now we are going to see what are the purpose. Okay. Number 1 is it's simple and accessible. Absorption of drug is more rapid. Slightly irritant drug can be given. Moderately large volume can be given, but not more than 5 milliliter. Intramuscular injection work faster and systematic effect of the drug. Yeah. Now we are going to see advantages. Rapid onset of action, uniform absorption, long duration of action, suitable for vaccine. Next, disadvantages. It is very painful. Next, chance of hematoma, chance of neurovascular bundle injury, large volume can't be administered. Now we are going to see precaution of intramuscular injection. Never use the same needle and syringe to insert more than 1%. It is important to know what reactions a medicine can produce and to take the recommended precautions before injecting. If any signs of allergic or poisonous reaction appear, never give the same or similar medicine again. Select the proper site and needle size according to age, weight of the patient and medication viscosity. Maintain sterile technique properly. Okay, now we are going to see what are the sites. Yeah, IM injection can be given. These sites, there are deltoid. This is deltoid muscle picture. Next, ventrogluteal. This one is ventrogluteal. Vastus lateralis. This is vastus lateralis and rectus femoris. Dorsal gluteal. Yeah, this is dorsal gluteal muscles picture. Others, quadricep site, rectus femoral site, tricep muscles. Okay, now we are going to see what are the angle. Yeah, this is intramuscular at 90-degree angle. If we need subcutaneous, we can insert the injection is 45-degree angle. Otherwise, intradermal 10 to 15-degree angle. Now we are going to see what are the equipments for administering the IM injection. Yeah, first, sterile container or kidney tray. Mainly intramuscular injection is a sterile, not a cleaning procedure. This is a sterile procedure, so must be follow sterile condition. Other equipment, sterile cotton, required medicine in an ampoule or vial, sterile syringes and needles, file, and surgical spirit. Now we are going to see procedure. Yeah, first check patient name and medication. Next, write patient, write drug, write dose, write time, write route, and write documentation. Next, explain procedure to the patient. Third, perform hand washing. Withdraw medication from an ampoule or vial. Don't add air to the syringe. Confirm the identification of the patient. Provide for privacy. Have the patient assume a position appropriate for the site selected. Ensure that the area is not tender, is free of lumps or nodules. Cleanse the selected site with an alcohol swab. Allow the alcohol to dry. Next, quickly dart the needle into a tissue at a 90-degree angle. Then, as soon as the needle is in place, use non-dominant hand to hold the lower end of the syringe. Slide dominant to the tip of the barrel. Aspirate by slowly for last 5 seconds. Pulling back on the plunger to determine whether the needle is in a blood vessel. If blood is aspirated, discard the needle, syringe, and medication. Prepare a sterile setup and inject at another site. If no blood is aspirated, inject the solution very slowly. Remove the needle slowly and steadily. After, apply gentle pressure at the site with cotton swab. If bleeding present, continue applying pressure, still bleeding stop. Assist the patient to a position of comfort. Don't recap the needle and discard the syringe and needle into the sharpin in the wart. Next, clean, dry, and replace the equipments. Wash hands and document the procedure. Evaluate the patient response to the medication with an appropriate time frame. Assess the, if possible, within 2 to 4 hours after administration. Yeah, now it's a demonstration time. Now, I am demonstrating administration of IM injection. Now, let's see the equipments. They are a sterile kidney tray, sterile cotton and sterile gauze, required medicine, sterile syringes, and sterile needles. Normally, when we give a IM, must be follow 6 rights. They are right patient, right drug, right dose, right time, right route, and right documentation. First, we need to identify the patient and check the order. This is imagine this is the patient. So first this is her BHT. First, I talk with my patient. Imagine her name is Lada. So I introduce myself. After I can ask some questions. Hi Lada, how are you? Did you check your meal? Or did your family members visit here? So some questions. After that, I explain the procedure to the patient. That time I can explain about that drugs side effects and purpose of these drugs, etc. After that, I wash my hands. Okay, now I did my hand wash. Normally, we have to check the drugs for 3 times. There are, when you take the drugs from the cupboard, next, before withdrawing medicine from the vial, finally, before administering the patient, now withdraw medication from an ampoule or vial. First, I take the sterile kidney tray. After that, I put the sterile needle into the kidney tray. It's dusty. If we need want to change needles, we can change the needles. Otherwise, no need. This sterile bottle, it has sterile bottle and sterile gauze. Now I am withdraw the injection from. Imagine this is injection. This is really this is distilled water. Imagine this is our injection. Now I am withdrawing the injection from the vial. While withdraw, don't add air to the syringe. Now I need sterile cotton. With alcohol, because Sprite is an antiseptic solution, so I use this Sprite. Okay, now our medication is ready. Now can you IM administration for my patient. This is another sterile kidney tray. Cover the kidney tray. Before I give the administration, I must check the patient and medication repeatedly. Okay. Now I am rechecking. Yeah, okay. Her name is Lata. Injection is okay. Okay. Confirm the identification of the patient and medication. Provide for the privacy and comfortable position. Now I am giving deltoid muscles, so no need privacy. So I comfortable position. I will make comfortable position and okay. This is sterile cotton with sprayed. First, I clean the. This is deltoid muscles. First, I clean the selected side. Next, left side. After that, I inject the patient 2/3. Okay. Now I aspirate the needle. If blood is aspirated, I can't give IM, otherwise I can give. Okay. Slowly and steadily can give. After that, I apply gentle pressure. If no bleeding, I can stop. Otherwise, continue gentle pressure to be given. Still bleeding settled. Okay. Lata, thank you for your cooperation. Now I discard the needle and sphincters into the sharpening. Put dustbin. Finally, wash my hands and document the procedure. After that, evaluate the evidence after procedure if she has or bleeding or swelling or other things. MS. Finally, I need proper documentation. It must be to be right given, must be we write the at time and a date. Okay, now we are going to see complication of intramuscular injections. First, early signs, there are swelling, redness, pain, injection, infections, allergic reaction, and inflammation. Next, delays complications, there are granulomatous inflammation, nodules, migration of the implant filler, scarring asymmetry. Okay, final part is conclusion. Yeah, intramuscular injection is the injection of a substance directly into muscles. In medicine, it's one of the several alternative methods for the administration of medication. Intramuscular injection is a parenteral technique that maintains several advantages over enteral techniques making it potentially useful in the management of pain and anxiety. Okay, if you have any doubts, you can ask me. Thank you.